very much for talking to us. Can you give us a bit of an overview where we are in terms of the search and the race to develop a vaccine? There's about 70 being developed worldwide, 3 are in human testing stages. What's your analysis on the pace at which they're being developed?
So this is really an unprecedented pace of vaccine development. Normally, we would expect a vaccine to be made in 5 to 10 years. In this case, we're saying, and the timelines are looking like, if things work, we may have a vaccine in 12 to 18 months. That is, we will know that it works. We won't necessarily, at that point, have enough to vaccinate all the people in the world who need it immediately.
Is there any potential for a sort of faster-paced type vaccine that might be made available for healthcare workers, those sort of in smaller groups, but there'd be something more immediate for them?
So I think that one of the most important things to know is that when we talk about 12 to 18 months, we are accelerating vaccine development nearly as quickly as we can. I know other people have talked about maybe getting it done in 6 months, but really, realistically, we're looking at a slightly longer time frame. If we do, then when the vaccine is available, it's likely going to be prioritized to those occupations that need it most because they are, in terms of care for this pandemic, critical. And, I think governments and organizations like the Coalition for Epidemic Preparedness and Innovations are really going to need to think carefully about whether countries or individuals within countries are going to be prioritized to get the first available doses of vaccine.
And of course, now there is that lengthy wait for that vaccine to become made available. In the meantime, can you just tell us about South Korea's strategy when it came to testing? Because it's something that the World Health Organization really stressed. Test, test, test. How did it work in South Korea? Was it effective? And should other countries be looking to do something similar?
Yes, in fact, I think the testing strategy was very effective. It really depended on having those test kits available when the country needed them. And so having these small biotechs really being able to be called upon to manufacture hundreds of thousands of test kits so that the government could begin the test, track, isolate, and treat program that it put into place very quickly. I think you're seeing the benefit of it in several of the European countries that have greatly scaled up testing. For instance, Italy is scaling up testing. The United States greatly increased its testing as well. It's going to be an important part of the slow release from all the restrictions that were put on during the pandemic. Testing is going to be a critical part of governments knowing when outbreaks are occurring and when they need to jump on a situation right away. Remember that this pandemic is like a fire, and the little outbreaks that occur after all the social distancing is released are going to be like the embers that could start the fire again. So governments have to be vigilant during the phase when they're beginning to relax some of